right? Thank you, Scott. Oh, just 3 of you. And Megan? Really? So should I not wait then? No? Okay. It's going to be a very intimate lecture today, I see. All right. So we're going to talk about formulas today, right? Because you guys are all confused. Aren't you confused? Every time Kelly and I fight, we're confused. Okay. So we're going to try to talk about is how I think through what we give and why we give it and how you can do it without patient mostly, because inpatient is a little more complicated, but let's think about it. So this is definition of formula, a food which purports to be or is represented for special dietary use solely or as food for infants by reason of its simulation of human milk. But it is partial substitute, right? It's not a complete substitute. It's not equal. So remember, nutrition is medicine, right? So remember, if you have ear infection and you give amoxicillin, you do it for 2 weeks. You do formula every day for 12 months, multiple times a day. So it is an important thing that you put in baby's body. So you have to think what you do. You have to know the difference between macronutrients and micronutrients, because again, there's something that's important to you. And you have to think why you're giving certain formulas to certain children, because again, you're going to see it in pediatric practice or whatever you choose to do. So why do we need formulas, right? So obviously, breast milk is the best, but let's say the situation is that you have no breast milk, or Dr. R said, absolutely not, we're not doing breast milk. Breast milk is contraindicated for one reason or another. So you can't just substitute for cow's milk, because cow's milk is not compatible at all, right? It's high in protein, high in sodium, it has really high solid load. And it's very allergenic to children, right? And remember, from just nature point of view, how long is the cough on the milk? About 3 months, right? And then they go to eat the grass. So this concept that we can have children on dairy for years and years and years when it's not even our milk, kind of really ridiculous concept. So, it used to be that if you can't do cow's milk or there was no formulas, babies would go on goat milk. If you're allergic, you do goat milk. A lot of people like goat milk, which is fine. I mean, it's going to be a board exam question forever and ever and ever. What this goat exam is lacking? That's a board exam. Goat milk. Goat milk does not have folic acid. All right, so if you have somebody who is on goat milk, make sure they're on folic acid supplements, because most of the time when they get goat milk, they get it from the farm. It's not in the stores. So when you make a decision about the formulas, the first thing you need to know is what the macronutrients, right? So it's fat, protein, and carbs, right? So when you choose the formulas in the real life, most of the time you're going to base your decision based on protein. So the biggest macronutrients you're thinking about is going to be protein. So intact ones, whey, casein, and soy. Hydrolyzed, when it's comfort proteins. You have extensively hydrolyzed, which are dry and tripeptides, and then you're going to have amino acids. So reflux, cow's milk protein allergy in the pediatrician office, if you're in pediatrician office, is going to be Alimentum Nutramigen. That's going to be your options. There's now Gerber extensively hydrolyzed formula. I really like it. I, in general, like Gerber versus other formulas because all the protein source for Gerber is whey, 100% whey, versus the other formulas that has whey and casein and has more casein than whey, versus breast milk that has more whey than casein. Remember that? It's also going to be a board question for you. So if you have really bad allergies, and that's they probably going to go to me, the FBI's kids, and I usually put them on amino acid-based formulas like Alicare and Alphamino and things like that. You can have metabolic formulas, right? Specifically PKU, galactosemia, maple syrup disease, all the other fancy things that you cannot pronounce, but it's going to be on the metabolic screen. It's a special way of doing it. There's a lot of calculations go into it. Nobody in the pediatrician office is going to do it. It's Greenwood Genetics manages everything in South Carolina. There's always going to be metabolic center in the state that will manage those patients. And then renal, right? So that is the one that for babies we use. It's called PM6040, which is low protein load for kids with renal failures. So again, you can think about what are you using for protein for. Now for fat, you start thinking about MCTs versus LCT, right? LCT is a long chain fatty acids is what we have. It's all the regular formulas. It's what cow's milk protein formulas have. MCT is medium chain fatty acids. We use it for cholestasis patients, right? Because if you have a cholestatic patient, they're not going to absorb fats. So then you have to go to oils. You still need fats. In babies specifically, you need fats because otherwise the brain is going to shrink. So you have to have a certain degree of fat. Ideally, you have to have at least 10%. So somehow or other, you need to do fat supplementation. And then if you have chylus infusions, right? So if you have cardiac kids that you see with chylothorax, or you can have abdominal kid surgeries, and then they have chyloperineum, for example. Those kids need to be on a very low fat formula because you need to make sure that lymphatics are not stimulated. Because you can't really make lymphatics, right? They have to grow back in and it takes forever. You can't really attach it like you can attach venous flow or arterial flow. So it takes time to grow back. And so those are formulas that you use that have very, very low fat concentration. The same for the transplant kids, because again, you attach the vasculature, but you don't attach lymphatics. So like low fat kids need to be on that for a while. And then ketogenic diets, that's all LCT. Right, so those are the kids, and you have different ratios for ketogenics. You heard that like 2-to-1, 3-to-1, 4-to-1, things like that. That's a ratio of protein and fat. And those are the kids, again, on special formulas that not everybody does, right? So carbohydrates, again, this is what you're going to have. The regular formulas that you guys offer in the breast milk are going to have lactose in it, right? You have to be very careful. It used to be 20 years ago, it was very easy because the formulas actually said lactose free on it, which was very easy. Now it says either sensitive or tummy or some other stuff that you really have to read and see what it means, because most of it is just, that's what it means, it's lactose free. But the companies will sell it as a comfort protein or something else that is confusing for everybody. I don't do lactose-free formulas. I think it's not really, there's no such thing as lactose deficiency in kids and small babies. So I usually don't do it. I just switch them to something that is different. But you kind of have to remember that. Every other formula that is pre-digested will be lactose free. So anything from Alimentum Nutramigen down that's over the counter is going to be lactose free. You don't have to think about it. It's going to be corn syrup salads mostly as a carbohydrate source. So sucrose is for taste. So there's a lot of sucrose in junior formulas, and there's a sucrose in Alimentum. Alimentum was created for the kids on temporary, like if you have somebody who is having rotavirus diarrhea, norovirus diarrhea. And so if they have something like that, and you want the kids who are used to regular formula or breast milk to go on temporary formula to rest the gut, the idea was we're going to put them on Alimentum and it's going to taste best because it has sugar in it, like sucrose. It tastes disgusting regardless, but keep it in mind. So like, that's one of the reasons I will do Nutramigen actually, because it's better. From clinically, it's a little better for like temporary transition. You're not talking about somebody who is on cow's milk protein allergy kids. You're talking about somebody that has like transient infection and you want to rest a little bit. So kids who are allergic to dairy, you know what to do, right? You kind of go down the steps, but there's some kids who are allergic to corn as well as dairy. And those are, there's no formula that is corn-free except Alimentum Ready to Feed. So you don't usually do that as much as I do, but if I go down the list of like, let's say I have a kid who has cow's milk protein allergy and I go down the formula choices that I usually go down to and I cannot get the successful result, I do everything the same way and they're not better, I will give them Alimentum Ready to Feed trial, because maybe corn is an additional option, and then sometimes they'll do really well on that. Splash, which is Neocate Splash, and we'll go about a little bit more of names and products and stuff like that, but I use a lot of Neocate Splash because it's rice source. So if I have, there's no neonatal formula, no infant formula that is amino acid based and corn-free. There's no such choice. So if I have kids who have really bad cow's milk protein allergy and I also have to take corn away, I will dilute the splash and make it like 20 calories, because otherwise there's no choice. I don't have any formulas like that. And then there are kids with congenital diarrheas, like something like microbial inclusion disease or really profound sucrase isomaltase deficiency, all those board things that you guys never see, but you always hear. And if that's the case, then you have to do the formula that has no carbohydrates in it. So there's only one formula like that. It's called Ross carbohydrate free. You can't be without carbohydrates, right? So to make a complete formula, you have to add carbs back. And the only carb you really can add to those kids is pure glucose. So you literally do RCF plus glucose to make it an intact formula. Okay. Are you still with me? Yeah. So in South Carolina, insurance covers nothing. Weak will. Yeah. So but usually like with Medicaid will cover all of that. And most of the time, cow's milk protein allergy is different, but like formula, the kids who have metabolic issues, they have other issues, they usually have at least secondary Medicaid, and then you can do formula. There's way around it, but it's not easy. So this is a standard distribution, what you want, about 30% of carbs and fat, and about 7 to 20% of proteins, depending on needs, regardless of what formula you use. Okay, so this is your ratios, right? So you never as close as you think you are, right? So you everything is a little more fat that you want. So that's why the kids are a little more fat when they eat well, right? But then when you go on baby foods, they slim down and grow. So I don't really care much about them being chunkies, as long as they eventually more mobile, because they will be. Right? So again, we talked about definition, right? So partially hydrolyzed, extensively hydrolyzed amino acids. Partially hydrolyzed formulas are not hypoallergenic, right? So the Gerber ones that are mostly partially hydrolyzed whey protein, they're just a little more comfortable. So it's not for allergy. It's more about, it's easy to break down. So if I have mom that is on a regular breastfeeding schedule and just needs a little bit oomph, a little more calories, I will do Gerber Good Start products because they're much more compatible to breast milk. They're much more comfortable. And so that will be a good supplementation for those moms, okay? So standard cow's milk formula, it's 20 calories per ounce until they're 12 months of age, and then it becomes 30 cal per ounce. And you have 3 different forms: ready to feed, liquid, concentrate, and powder. It used to have liquid concentrate. It's not actually that common anymore. You almost cannot find it anywhere. You will have ready to feed, like Nutramigen has ready to feed, Alimentum has ready to feed. It's much more expensive, but for some reason or another, it's much smoother. So some kids have texture issues. You can do that for them, but most of the formulas will come in a powder form. So there's 3 big lines, right? You're gonna have Mead Johnson, which is an unfamiliar line. You're gonna have Abbott, which is a Similac line, and Nestle, a Good Start line. So for the Nestle, this is all your pictures. I tend to show the families the pictures because they're like, well, you know, this purple bucket with the green line, and you guys don't go and look at it in the store, so you have no idea, right? And they don't know because, and I hear routinely, oh yeah, we went through so many formulas, and then you start digging into it and every formula is the same and you guys didn't really change anything, right? But so this is a Gerber picture. As you can see, there's a lot of choices for Gerber. There's a lot of choices for Mead Johnson, right? Again, the purple can, the blue can, the something else can. It's just like try to figure that out, right? There's a little bit of a line color, so you can kind of know, right? Because for example, this is Abbott, right? So the purple can is going to be Alimentum, right? And orange can is going to be Nutramigen. So you kind of sort of can get an idea, but again, you go in the store, you start looking at all of that and I'm like, my God, and I know what I'm looking for. Imagine like if you start looking at it, it's just crazy. So I just pulled the pictures and was like, all right, tell me what it is. A lot of it is a repetition. A lot of it is just a sales gimmick because, you know, again, it's talking about whatever is in the store, most of it is going to be either lactose free or it's going to be slightly broken, or it will have reflux, which is complete BS, like AR or things like that, which you really shouldn't do anyway. Okay, we talked about cow's milk composition. So it used to be much easier because it was stupid proof. And it's still over-the-counter formulas are pretty much stupid proof. Means that every formula gets mixed the same way, right? So it's 1 scoop per 2 ounces, and that will give you 20 calories. So there's a little bit of variation now, so you have to be careful. Like Pure Amino line is all 1-to-1. Neocate line varies can by can. So this is something that you just have to keep in mind, because if it's not appropriately mixed, it's going to give you complications. But in general, in the stores, the formulas will be 1 scoop per 2 ounces to make appropriate concentration. So again, coming back to Nestle Good Start, I like it for, again, pure supplementation for somebody who's not really allergic, who just needs a little bit of help. I'm okay with that. Now, soy-based formulas, again, liquid concentrate, I should probably take it out of here because it's really not that much. There's only very few reasons you should use soy formulas. And those are the indications, right? So lactose intolerant, maybe. Strict vegetarianism and galactosemia, right? So those are the 3 indications for soy. Not milk protein allergy, because there's about 40% cross-reactivity. So again, I do not use soy as a substitute. The other thing with soy is has estrogen relations. So, you know, you don't want gynecomastia on the boy when they have 40 ounces of soy milk every day. So I do not do this. Soy is not the choice. And again, even AAP recommendations are telling you the same thing. Right? And I don't usually agree with AAP, but I am agreeing with it now. Take note. Dr. R agrees with AAP. Okay, so the ones that you get exposed to on the wards or in the clinics, right? Extensively hydrolyzed will be Alimentum, Nutramigen, Gerber, and Progestamil. and Alimentum is Neocate, Elecare, Pyramid, Alphamino. Okay. I just kind of rattled them in because from your perspective, there's not a lot of difference, right? You kind of like, it goes over your head when Kelly and I start arguing about what formula we're going to pick. So there's two things that, so again, for protein hydrolysates, right, you're going to have, we talked about this, corn syrup solids, cornstarch. That's why they're all kids, if they're allergic to corn, there's just enough corn in the cornstarch that they get sensitive to it. Protein source is going to be casein hydrolysate, right? So it's not going to have milk, but the source is going to be casein. And then fat is depending, it can be the corn oil, soy, safflower, MCT oil, depends on what it is. So why would I pick Alimentum over something else? So it is obviously lactose-free. Theoretically, it tastes better, though it doesn't. It does have fat in it, MCT oil. So Alimentum was my choice for kids who are cholestatic because it has MCT in it and it's readily available. It used to be the Progestamil was a be-all for kids with biliary atresia or short gutters and things like that, because it has even high amount of fat in it, MCT, but it's really impossible to get outside the institutions and there's no point of it. I mean, 33 to 50% of MCT is more than enough to provide patients with cholestasis with nutrition. So I put that. The same thing goes for young kids with cystic fibrosis, right? CF kids need to have MCT. So that's why Alimentum will be a decent choice for them. And again, the indications, as you can see. Now, Nutramigen is also lactose-free. It has corn syrup solids. It doesn't have any sucrose. It does not have any MCT, which is a benefit for somebody who's on short-term gut rest, because MCT makes you really, really gassy. And so if you need MCT, it's great, but if you don't really need MCT, you don't need to give it. And so somebody from the bowel rest with an infection or something, I like Nutramigen much more because it is all LCT. It will stay in the gut as long as possible. So I like it. Again, Progestamil is great. It's not available outside. It's almost impossible to get. So it used to be before Alphamino came on the market, every NICU graduate would go on Progestamil home, and then I would pull my hair out because I couldn't find it for my patients. And so I just put them all back on Alimentum and it was fine. So elemental formulas are all 100% amino acids, right? Corn syrup solids is a base on their starch source. Most of them are going to be about 33% MCT. And again, they're all milk-free, lactose-free, sucrose-free. And the palatable, I don't know. Kids have a very different taste buds, right? If you start them early, they're going to be okay. I find that the difficult kids are the ones that have been on 6 months of breast milk and develop taste buds. And then they like, hell no, I'm not going to do Elecare. It's disgusting. But I do also have little kids, like really, really little ones that won't take straight Elecare, but they will take Elecare vanilla, for example. So I will dilute it down for them. Or the other thing, I will do the tricks. I will just put the vanilla beanstalk in the bag, so just to get aroma in. Some kids are more sensitive than others, but the younger they are, the easier to transition them. So I don't know why Mead Johnson decided that they need to create pure amino, because it's completely redundant formula and it's also hard to mix. But you know, they're all competing for the same market, and so they're all trying to fight against each other who's doing better. There's pretty much no difference between Neocate and Elecare at this point, especially in the infant form. Alphamino has much higher concentration of MCT, so that's a choice for kids and cholestatic kids in the NICU. Like you'll see that a lot of them will be on Alphamino if their bilirubin is a little higher, which is totally fine. I'll tell you, practically, that's where the MCT is becoming a challenge, because I switch a lot of them back to Elecare when they come out because they have looser stools. That's so much MCT that actually makes them have looser stools. So I'm chasing my own tail, makes them drier. So I don't fight NICU anymore. I just let them be until they come out, and then I'll just change the formula. So cost-wise, Neocate is the cheapest. It's still very expensive. I mean, that's a ridiculous amount of money. I mean, look at what you eat right now. Your lunch is probably cheaper than the bottle of formula. Kids are expensive. And so the only formulas that are available, so TRICARE will cover it and Medicaid will cover it, but commercial insurances here are not covered. Depends state by state. The more northeastern state and California will cover it, but like southeast won't cover it, middle of the country won't cover it. So it depends on where you work. Sometimes you can trick the formulas, but they're pretty much compatible from the price ones. So the other thing I don't know whether you guys encounter it that much. I suspect that private pediatricians see that more than you guys do because we don't have that much of a private population. We have a lot of Medicaid patients, but there's a big movement on European formulas. There's this line called Holly, and there's another one called HIP. This you probably see more than the other one. They're both lactose whey protein formulas. They are not hypoallergenic, right? And so the only difference between those formulas, really in American formulas, is actually the source of milk. So I don't know whether you ever heard about this. It's called A2 milk. So, so A2 milk is the milk that came from Europe. It's like European countries. So the story goes is that when pilgrims landed on the Plymouth Rock, they brought Jersey cows, right? And so Jersey cows mutated, and there's one mutation in the casein that is making it A1 milk. So European cows didn't mutate. So theoretically, you should call them A1 and us A2, but we're always the first, right? So, but the point is that there's enough of mutation to cause dairy intolerance in the American population, not only in kids, but in population. And so there's a big movement now of changing to A2. And if you go to the store, you're actually going to see that A2 milk. It's a little more expensive, but it's like you have to talk to people and they will tell you that it's much more tolerable. Or people who travel, they'll say that they cannot drink milk here, and then they'll go to Europe and they have like a plate of cheese in Paris and they're fine. So, and that is because they use a different A2 milk. So European formulas are A2 milk based. And so the kids who are sensitive, they're not really allergic, but they're sensitive, they will do better on those formulas. I think everybody should move to Europe, at least to get exposed, right? Though coming from the person who just moved from Europe 30 years ago, it's like, but yeah, I think there's a lot of things in it, right? Because pilgrims moved 300-400 years ago. Cows' milk intolerance is exploding now. Like as a fellow 20 years ago, Neocate was ordered from Switzerland, and there was no formulas here like that. And now I would do it like water. So there's a lot of other things coming into play for allergy, including hygiene hypothesis and all that other stuff that's happening over the last 30 years, how we make our food and other thing. But I can tell you more often than not, like when I have friends talking to friends and my colleagues, they do a lot of A2 milk who were lactose intolerant, quote unquote, and they will switch to A2 milk if they're milk people and they really enjoy it. So that same thing, like the kids do better on European formulas because the milk source is different, even though it's an intact milk. So if you go to the pediatric formulas, are we okay, guys? Am I late? Oh, we're okay, right? The concentrations goes up, right? So it's a 1 cc per cal, 1 cal per cc, a 30 cal. That's your Pediasure, that's your Nutren, that's Peptidin Juniors. Most of them I said lactose free and gluten free. Yeah, because people will look for that as well. But you know, if you have a celiac patient and they want a supplement, I actually think Pediasure is really decent oral choice because it is lactose free. Most of the gluten kids are going to be slightly lactose intolerant, and it's gluten free. So obviously they're not going to worry about contamination. And the celiac kids really need to be careful with cross contamination. So it's not bad issue, you know, it's be okay. There's the nutritional complete for children 1 to 10. It's a standard statement, but when you go from juniors to adult formulas, there's not a lot of changes except micronutrients changes. So you might have a little bit of different vitamin mix. You might have a little different mix of like magnesium, calcium, and vitamin D in it. So it's not that big of a deal. So if somebody is on Pediasure at 15 because they like it, you shouldn't rip it out of their faces because they have to go on Boost because Kelly said so. No, because you know it's because they're older. So there's not a lot of difference there. You don't have to worry about it as much, especially if it's oral, right? If you have somebody who is actually enjoying it and you need to supplement them and they like that particular bottle and that particular taste, there's no point of arguing about this. I'd rather them take it than start following the rules. All right, so oral supplements, that's what we use it there. You got to be careful because a lot of those formulas have high osmolarity, which doesn't make a difference if they drink it, but it makes a huge difference if you tube feed them. So you can't just put Pediasure vanilla in the tube and think the kids are going to do well if they can drink it. Like there's a difference. So that's where the osmolarity comes in. Obviously, all of those things like listed here have different tastes, right? So over-the-counter stuff like Pediasure Boost, Breeze, Carnations, and breakfast, they're actually pretty good tasting. Like everybody has different tastes. They're a little super sweet, I would think, like strawberries and cappuccinos and stuff like that. They're fine. Nutrien Junior is not in the over-the-counter. It's unflavored, and it's really good formula for tube feeds. So I usually use Nutrien a lot. We have Nutrien in the hospital because it's Med Johnson formula. So hydrolyzed formulas have flavors, right? Most of them are going to be vanilla flavor or strawberry flavors. And again, like CFers, if they like their Peptamen or like the Pediasure peptide, that's perfectly fine. That's what I will supplement CFers with, and that's where the flavored formula is. Peptamen Junior was actually the first formula created specifically for nutritional supplementation, and it was driven by cystic fibrosis patients because it does have MCT. So that's where all of it started. So elemental formula, Neocate are the guys who created Elemental Diet. They're Swiss-based company, and that's where all the Elicares came back later, and Pure Aminos and Alpha Amines. And Neocate was the first one, and they still have the most extensive line of flavored elemental products. So if you have somebody who has eosinophilic esophagitis, so they have short gutters and they want to drink something, I really like Neocate line, so I'll use a lot of that. And then you have your disease-specific Ketocol and PKU patients and all that stuff. That nobody cares how much it tastes because most of those kids are going to be on G-tubes because of the volume they need and the drips they need and all that stuff. Okay, so those again, they're going to be pediatric formulas, mostly over the counter, elemental and semi-elemental formulas, right? We talked about this. This is the last slide, so we'll stay on this a little bit more. Is that okay with you? You're still bored? Yeah, okay. So, you know, this is where you kind of start, this is where the elegance becomes the issue. Like, that's why I like nutrition, because you can make elegant solutions, right? So Pediasure peptide, for example, is really good tasting, tastes delicious, but it has all LCT. So like I have somebody who has eosinophilic esophagitis, Pediasure peptide might be my formula to go to because it's much more palatable than anything else. Kids with feeding aversions that you can't explain, right? Those are the kids I'll put on Pediasure peptide because a lot of times the feeding aversion is a combination of multiple factors. And if you can get them to drink something that makes them less hungry, more comfortable, they might be more receptive to speech therapies, right? So that's pediatric peptide for me. So like, this is my first step. That's where I start them with. Peptamen Junior is, again, is the oldest formula on the fancy medical nutrition side. This is what started it all in a way. And it started from cystic fibrosis patients. So I like this formula for anybody who's cholestatic because it does have MCT. And the reason it has MCT is because of cystic fibrosis patients again. Okay. So I use it for a lot of my cholestatic patients. I use it for a lot of my short gutters. It can be flavored and unflavored. So sometimes I can combine them. Like if I have CFer, I can during the day give them vanilla and then run unflavored at night in the tube if I have an option. So I like that. Elecare Junior, Neocate Junior, like the junior formulas there that are elemental ones, there's not a lot of difference in them per se. Except alphamino. Alphamino for some reason gives them more diarrhea. So this is going to be always my last choice for the kids because I'm a GI doctor and I don't want to have diarrhea. Flavors wise, Neocate has the most flavors. Elecare just caught up. And so they have chocolate, they have strawberry, they have vanilla. So again, for kids who have EOE, for kids who are short gutters and they want to drink, for the kids who have aversions and have some allergies, those are the good choices. Somebody who I can transition, for example, like if I have a kid who had CMPA as a baby and we're on Elecare and they're not ready to transition to regular cow's milk for whatever reason, I'll do those formulas and make them drink a flavor. You can also cook with them. So a lot of those, the Elecare and Neocate for sure, that you can make milkshakes with them, you can cook with them. So that gives you a little more flexibility to have a good baseline for that. And so you can add that, you can make like banana pudding with that, or you can add it to oatmeal or make some other smoothie with that. So it gives you a little more flexibility. Anybody who eats orally, you don't have to worry about osmolarity anymore, right? After they're 12 months of age and it's not a G-tube, you eat steak and potatoes, the osmolarity of steak and potatoes is probably 5,000 osms, right? Nobody cares, it drops in the stomach. So you don't have to really worry about osmolarity as much. If somebody who is getting G-tube feeds only, then you worry about osmolarity because that's a short gutter or it drops directly in the stomach, or you have kids who have renal issues or something like that. So you have a little more thought process you have to put in it when you pushing the formulas in. But for oral, whatever works for you. You know, if this kid wants it in the chicken soup, additional to Elecare, go for it. You know, if they want to make ice cream out of it, go for it. You can. So that's a little easier, just more about what the family wants to do and willing to do for nutritional supplements. Does that make sense? All right, any questions? Yes, pediatric peptide ice cream is delicious. Yeah, so it used to be, first of all, if you like have money and you can actually buy fancy ice cream maker, you can make ice cream out of all of them. But what I do to my kids, Sharper Image has this, and it always comes around Christmas. They have those ice cream shakers balls. They're about $30. And so you buy them like a gift, and like you literally pour stuff in it and you make the ice cream out of it. And it's cheap. And so like that's what I tell my families if they want to do it, and if they don't have enough money to buy fancy ice cream maker. The other thing you can do is you make a slushy out of it, like just put it in the refrigerator and makes like a little kind of like slushy, 7-Up slushy kind of thing, you know. You can do that too. Chuck, words? Anybody? Oh, look, Liz, don't hide. You guys have questions?
No, but thank you very much.
Thank you.
Milk is the white devil.
Yes, white poison. Stop paraphrasing me.
White poison.
Yes, remember that. Otherwise, they're gonna hang me on the cross. We're South Carolina. You kidding me? I cannot say devil. Wards? No?
Hi, this is
Yes.
Megan. I have a question.
Yes.
Some of the kids that I saw in Keto Clinic on neurology, their parents would make their own sort of formula by taking food and mixing it.
Yes.
Is that something you see very often?
So that's a question of blenderized nutrition, right, Megan? Yeah. So there's differences. So ketogenic formulas pre-mixed, but before they were pre-mixed, people could do it and they would do the concentrate fat ratio, special fat ratio that will put like Irish butter and things like that in it and make sure it's really, really fat for ketogenic formulas. We do a lot of blenderized nutrition because it is more natural, quote unquote, and there's new formulas on the market that are consistent with that. But it started with the families who did it themselves. And actually the first family population that did it was smooth muscle atrophy kids, SMA kids. Yeah, and for some reason it just exploded out of that. It's more physiologic. So if I have somebody who is a failure to thrive and I want them to transition to PO at some point, I will stop with transitioning them from regular formula to blenderized nutrition. Or if I have somebody who is volume dependent and you try pushing them and you can't, you can do blenderized nutrition. So there's a bunch of new formulas on the market to do that. They're much more concentrated and they taste disgusting. And so those are the formulas for kids in the G-tube. And like my surgeons now know that if I'm transitioning the kids, the tube size should be specific. Like it doesn't go through 12 French, it has to go through 14 French. And then if you do that, if you do the blenderized nutrition, which I am a huge fan of, you do that, you really have to remember about volumes, right? Because your food, your calorie requirements will change with age, your fluid requirements won't. So if you have somebody who is 5 years old and going on, 500 cc's of formula, that blenderized nutrition that might give you 2,000 calories and a very small amount of food, because literally like blenderized nutrition can be salmon and brown rice or something like that. So it's going to give you a fair amount of calories in a very small amount. But then they're going to be plugged up because you didn't give them enough water. So you really have to remember that and give them water on top of it.
That makes sense. Thank you.
Of course. Okay, guys. All right. Well, have a good day. I'll see you next week on service. No problem. I'm actually going to hang out here because apparently I'm meeting somebody here right now.